Okay, ma'am. Is my slide visible?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Ma'am, should I start?
Yeah, start. Go on.
Oh, okay. Good morning, ma'am, and good morning, second years. So today I am Miss Tailang Munya from first year MSc Nursing. So today I'll be doing a practice teaching on my topic, chronic renal failure. First, moving on to the introduction. Chronic renal failure. The other name of it is your end-stage renal failure, or we even call it the end stage renal disease. Okay, it is a permanent damage of the kidney where the kidney they fail to do their function completely. And a patient with mainly we say that the failure patient, okay, they can only survive for like more days or more months only after undergoing dialysis, or if they undergo for any transplantation. According to the National Center for Chronic Disease Prevention and Health Promotion, they have found out that in USA, 15% of the adults, that is out of in 30 million people, they have found out that 15% people they every year they suffer from chronic kidney disease. Okay, moving on to related anatomy and physiology. I think all of you you have studied about the anatomy of the kidney in the first year. So I'll just briefly explain about the anatomy of the kidney. The kidney is a bean-shaped organ which is located retroperitoneal, one on each side of the vertebral column, that is between the thoracic 12 and lumbar tree. Each kidney is about 12 centimeter long, 6 centimeter wide, and 2 centimeter thick, and kidney it weighs about 125 to 170 gram in men and 115 to 155 gram in female. It also consists of parts of your kidneys like your renal cortex is there, renal medulla, renal capsule, minor calyx, major calyx, renal pelvis, renal papilla, renal pyramid, renal column. Then each kidney, as you all know, that kidneys that it consists of a 1 million nephrons, and this nephron is considered to be the functional unit of the kidney. Okay, these are the parts of the kidney, and this kidney, the main function of the kidney is it helps in excreting out of waste product from the body, waste product like serum, like urea, creatinine, and all from the body. Now moving on to the definition. Chronic renal failure or the end-stage renal disease, it is a progressive irreversible loss or reduction in the renal function that the kidneys are unable to maintain the body's internal environment such as metabolic, fluid, and electrolyte balance. It means that the kidney chronic renal failure, this is a stage or a condition where a kidney, they will completely lose their function, leading to leading to some other leading to failure to do their normal function in their body, like in maintaining the electrolyte balance in the body, as well as metabolic function. It is also one function done by the kidney as well. So they will fail to do all this function in the body. Moving on to the incidence. In India, as per population-based study, they have calculated that end-stage renal disease incidence is seen like 152 per million population in India. And the foremost reason for this end-stage renal disease is your diabetes. Next, moving on to the etiology. This etiology, they are divided into three parts. We will discuss them one by one. First is the systemic disease. Systemic disease means any disease which occurs in the body, leading which because of those particular diseases only this patient can be at risk of developing this chronic renal failure. So some of the systemic diseases are your diabetes mellitus. This is the one of the most commonest cause of this condition. So in diabetes mellitus, what happens is that the diabetes, as we all know, that there's excessive release of glucose in the blood, so leading to excessive damage of kidney. This is the one of the foremost reason why diabetes mellitus patient can be at risk of developing CRF, chronic renal failure. Another is your hypertension. Hypertension also, when there's excessive rise in the blood pressure, that time also the patient can be at risk of. Next is your lupus erythematosus. Lupus erythematosus, this is considered one of the autoimmune disease. Autoimmune means where the immune system, they will attack their own healthy tissues. So those condition we call as your uh, lupus erythematosus. Next is your polyarteritis. Polyarteritis, it is a very rare condition of your blood vessels. Okay, in this condition, what happens is that the blood vessels, they will be inflamed, leading to damage of the nearby organs. Next is sickle cell anemia. Sickle cell anemia, this is a condition in which our body, they will fail to produce enough RBCs. As RBCs, they are responsible for carrying out this one oxygen to our body. So in this condition, there will not be enough RBC production in the body. Next is amyloidosis. Amyloidosis, this is a condition where our body, they will produce a abnormal protein which is known as amyloid. When there is excessive production of this amyloid in the body, especially it will develop in your organs like your heart, kidney, and all. So when this excessive this condition, this amyloid protein is developed, it will lead to certain condition. Patient will look lethargic, patient will have constipation, then excessive passing of urine. Those kind of condition can happen. So this is the systemic diseases because of which chronic renal failure occurs. I hope it is clear.
Yes, ma'am.
Any doubt in here?
No,
Okay.
ma'am.
Okay, moving on to the next, that is your local causes. Local causes means any condition because of which because of those disease condition only, this your condition because of your previous those condition only, this chronic renal failure can occur. First and foremost is your uh, chronic glomerulonephritis. Chronic glomerulonephritis is a condition in which there is a inflammation or scarring of your glomeruli. Okay, because of this also patient can be at risk of forming this condition. Next is acute renal failure. Acute renal failure, this is a condition in where patient, they cannot filter waste product from the blood. So in this condition, when if the patient already has a history of acute renal failure, then there is a high risk the patient will also have chronic renal failure if treatment is if not proper. Then if patient can also have also because of condition like repeated episodes of pyelonephritis. Pyelonephritis, it is a condition where there's a damage of your renal parenchyma. Okay, next is there's obstruction of the urinary tract. Any obstruction in the urinary tract or any damage in the urinary tract, it can lead to this condition. Next is polycystic kidney disease. Polycystic kidney disease, this is a condition in which a pouch or a shake like area will be filled up in your kidney. Okay, and this shake, they will be filled up with the fluids. So in those conditions also patient can be at risk. Next is vascular disorders. Vascular disorder, these are any kind of disorders where there's a damage of your arteries or the vessels and all. Okay, the first and foremost condition is your hypertension. Next is the nephrotoxic drug. Nephrotoxic drug means when the patient, they are taking excessive amount of drugs, like mainly for the kidneys. If they are taking high toxic drugs, okay, mainly to release out this waste product from the body. So excessive intake of this also, the patient can be at risk of causing more damage to the kidney. Then overuse of common medication. Common medication like your aspirin, ibuprofen, and acetaminophen. So some of these common drugs, they when excessively you're using, then there so there can be damage to the kidneys. So this is the second cause. Then the third cause is your environmental and occupational agents. The patient, if they are excessively being exposed to like lead, cadmium, mercury, and chromium in your occupational area, while in a working area, if you are being too much being exposed to such your metals like your lead, cadmium, mercury, and chromium, that time also patient can be at risk of. Then also like some disease condition which is known as infectious disease is your Hunter virus. Okay, this Hunter virus, this is one kind of virus, Hunter virus disease. Okay, in this Hunter virus disease, what happens is the patient will have severe respiratory problems. Okay, and the main reason for this is your uh, the where the main reason for this is your ingestion of this Hunter virus in your body. So I hope etiology is clear. So Next, moving on to the stages. The stages is very important when if you ever come in contact with any patient with renal failure. So based on the stage only, you'll be able to know whether the patient is, how severely the kidney is damaged. So as we have all learned that the normal in your, I think in your first year also, you have learned about the anatomy of your kidney. There you have learned that the glomerular filtration rate, the normal glomerular filtration rate, in case of adult, it is like more than 90 ml per minute. And if we say that the glomerular filtration rate is less than 15 ml per minute, that means it shows a signs that the kidney is completely damaged. Okay, so here we'll see the stages one by one. In the first stage, glomerular filtration rate that is more or equal to 90 ml per minute. Here, the sign and symptoms which can show are there. Patient will not show any symptoms of kidney damage. Okay, so as this is a normal. So in stage 2, that is glomerular filtration rate, here it will be 60 to 90 ml per minute. So here we can see some like mild decrease in the glomerular filtration rate. That is, you can see that is between 60 to 90, and patient will be asymptomatic, no like any kidney damage symptoms will be there. But when we go for any blood test and all, so we can see certain abnormalities, like there might be a little bit rise in your like sodium, urea, little bit rise it can lead to. And also patient will have symptoms of hypertension. Next, in the stage 3, that is the glomerular filtration rate of 30 to 59 ml per minute. Here, the symptoms, sign and symptoms which you can see are the moderate decrease in the glomerular filtration rate, and patient will we here in this condition also patient will experience as like patient will be asymptomatic, but they will have like conditions like hypertension. And also laboratory abnormalities can be seen when you undergo any kind of like urine analysis. When you do it, you can see that there's some like little bit fragment and all, they are present there. Next, moving on to the stage 4, that is here, the glomerular filtration rate is 15 to 29 ml per minute. Here, the signs and symptoms which you can see are there's a severe decrease in the glomerular filtration rate. Symptoms of kidney failure, now they will start to show up, like there will be excessive urea, excessive sodium level is risen up, so creatinine level will be very high. So all those symptoms, it can lead to the signs that there is a high risk that the kidney is in bad shape. So the last and the foremost, that is stage 5, that is glomerular filtration rate less than 15 ml per minute. So in this condition, the kidney will be permanently damaged. Okay, because of this, there will like here it is written that clinical manifestation uremia appear. Uremia appear, the excessive buildup of urea will be there in the kidney, leading to permanent damage of the kidney. So here the kidney, they will not be able to function anymore. So are you clear with the stages?
Yes,
Yes.
ma'am.
So can you please tell me what is the normal glomerular filtration rate of an adult?
Is equal to 90 or 110, something like that.
Then what is how can you find out that the patient has glomerular, if like patient has complete kidney damage? When the person has complete kidney damage, so what will be the glomerular filtration rate of a person, patient?
Less than 15 ml per minute.
Okay, I hope you are clear. So I'll tell you again, in case if the glomerular filtration rate is more or equal to 90 ml per minute, that means it is a normal, like kidney is functioning well. But if it is less than 15 ml per minute, so it shows that kidney is permanently damaged. Okay. Now moving on to the pathophysiology. Pathophysiology due to the etiological factors. The etiological factors which we have discussed, like your systemic disease, like your diabetes, hypertension, and all the local causes like acute renal failure and all due to exposure to any kind of environmental and occupational agents, it can lead to irreversible damage of your nephron. The nephron in your kidney, they will slowly and steadily start to get damaged. Because of the damage of the nephron, it will lead to because of that the kidney will not be able to do their normal function, and also there will be glomerular filtration rate will be decreased. And because of this, there will be excessive accumulation of your serum, that is urea, nitrogen, and creatinine in the blood. So when this is accumulation of this urea, creatinine and all, immediately if you do your blood test and all, you can immediately see the rise up of this serum like urea, creatinine. It will be very high in the test. So next it will lead to nephron hypertrophy. Nephron hypertrophy means here the nephron, okay, in order to filter a large amount of solute from the kidney, they will put a lot of force in that, leading to excessive damage of the nephron. So because of this nephron hypertrophy, it will lead to two conditions. One is that they will lose the ability to concentrate urine and reabsorb electrolyte. That means the urine, it will start to, their small fragments, they will start to form up there, okay, and it will lead to uh, excessive, and it will also lead to condition which known as polyuria. So I hope you know what is polyuria. Hello?
Excessive urination. Excessive urination.
Yeah, excessive urination in the body. So because of this, it will lead to, with the time, if not proper treatment given at that time, then immediately like more and more damage will occur, and glomerular filtration rate also, they will fail to do their function, leading to excessive amount of excretion of waste in the kidney itself. And when excessive amount of kidney waste is excreted inside the kidney itself, they will fail to release out these toxins, leading to excessive damage of kidney, and uh, permanently the kidney will be damaged. And at that moment, if like only one kidney is damaged, then okay, patient can survive with the other kidney. But if both the kidneys are damaged, and if the patient doesn't undergo immediate transplantation, then patient can be risk of, patient can like also ultimately die also. So I hope pathophysiology is clear. So next, moving on to the clinical manifestation. Okay, most of the symptoms, it depends upon certain condition. First is the due to cause of the kidney disease. Why the disease condition, why the kidney disease has occurred? Because of that, the next is at which stage the renal failure has started, at which stage the kidney has like its damage has reached now. And next is age of the patient. Age of the patient, a patient who are at the age of 60 or more, then they are at high risk of getting chronic renal failure, associated with other, if disease condition is present in the body as well, like diabetes, and also they are at more risk of getting this condition. Then okay, next fourth is other associated medical condition. As I've said, that diabetes mellitus, hypertension, associated with that also, they can be at risk of. Then next, degree of compliance with the treatment. Degree of compliance with the treatment means how well the patient is responding to the treatment. If not responding to the treatment, then immediately the patient might have to undergo your transplantation and all. So the main symptoms, it starts occurring when there's excessive buildup of toxins in the kidneys. Okay, that is which we'll discuss one by one. First is the high level of urea in the blood. Next is high level of potassium in the blood, high level of phosphate, full volume overload, decreased synthesis of erythropoietin, metabolic acidosis, which we'll see the symptoms one by one. First is high level of urea in the blood. Okay, it causes symptoms like anorexia, bad taste in the mouth, nausea and vomiting, diarrhea, polyuria, and nocturia. Nocturia means excessive passing of urine at the night. Then oliguria, anuria, presence of cast and protein in the urine, foamy and bubbly urine, lethargy, symptoms of encephalopathy. Symptoms of encephalopathy means certain symptoms like where the patient will have like a, patient will not be able to concentrate in certain things. They will have memory loss. So all those symptoms we can see there. The uremic frost on skin, that means excessive buildup of, due to excessive buildup of urea, it will lead to certain conditions on the skins, like patient will start to have rashes and all. The next is elevated blood urea nitrogen level in the blood. So these are some of the symptoms which we can see if there's excessive buildup of urea in the blood. Next, moving on to high level of potassium in the blood. If there's high level of potassium in the blood, then it can lead to condition like malaise, where the patient will be lethargic and they will have a feeling like they are weak, sick, and tired and all. The muscle paralysis. Muscle paralysis because due to excessive buildup of potassium and also due to waste product, okay, patient will start to have leg cramping and all. So because of that, muscle paralysis can occur. Next is a life-threatening dysrhythmias, as the patient is high risk of of having hypertension, so this condition can also occur. Next is high level of phosphate. It will cause symptoms like itching, bone damage, non-union in the broken bones, muscle cramps associated with hypocalcemia, that is low calcium, that is hyper. Next is hyperparathyroidism in the later stage, that is high thyroid production in the body. So this phosphate, they are mainly responsible for your calcium production in the body. They are mainly responsible for your developing of your bones and all. So if excessive amount of phosphate is present, then it can lead to certain disc condition also. Next, fluid volume overload. It will cause edema in the legs, ankle, feet, face, and hands. Shortness of breath due to pulmonary edema. Then high blood pressure, congestive heart failure. So these are some of the symptoms which you can see. Then decreased synthesis of erythropoietin leading to anemia. This erythropoietin, they are mainly responsible for, they are like their role is to help in building up of RBCs in the blood. So if this there's a decreased production of erythropoietin, then it will not produce RBC, leading to anemia. Okay, so because of this, you can see symptoms like fatigue, difficulty, concentration and disturbance in the memory, dizziness, headache. So next, moving on to the metabolic acidosis. Metabolic acidosis is a condition where they have excessive buildup of acid in the blood. Then the symptoms which we can see out here are the severe diarrhea, deep and rapid breathing. And the very common this one symptoms which we can see are the back pain at the beginning of the when the patient will start to have condition, the like will start to have this disease condition that time. So these are the sign and symptoms. Moving on to the diagnostic studies. First and foremost, history. In the history, we have to collect the complete history of the patient regarding like past medical history, if the patient has undergone any kind of uh, surgery in the past and all those stuff, or if the patient has any like acute renal failure in the past. So these things need to be collected, and also if the patient has any kind of fluid overload, then we can also check there like what kind of diet the patient is taking, stuff like that we have to find out in the history. Next is urine analysis. In the urine analysis, we can see there's a excessive presence of protein urea in the blood, as well as in the urine, sorry. And also there we can see that there's a presence of creatinine level in the urine. So in case of blood also, we can see that the creatinine is very high, as well as we can also see that blood urea nitrogen has elevated, as well as electrolyte level is altered. Then there will decrease hematocrit and hemoglobin level also, it will be decreased as the patient is risk for having anemia. So that is the reason. Next is renal ultrasound. Renal ultrasound, it is mainly done to check for like size, to check for the size of the kidney, to check for like any obstruction in the kidneys. So next is CT scan. CT scan, it mainly reveals the obstruction or the presence of lesion, like or the pouch. In the case of polycystic kidney disease, there's a presence of pouch filled up with the fluids. So all those conditions, to detect all those conditions, CT scan is done. Next is renal biopsy. In the renal biopsy, a tissue will be extracted from the kidneys, mainly to check for like how well the kidney is functioning. So these are the diagnostic studies which we can perform in chronic renal failure patient. Next, moving on to the management. Management first is the medical management. First, we have to go for all the conservative therapies, like we have to check out like whether the patient is in which stage. Then based on that, we have to start the treatment as well. Then we have to also see for all the sign and symptoms of the patient, or any complication is associated with this disease condition. So here under conservative sub things which we need to maintain out here are the control and treatment of hypertension, which is very, very important. For that, we have to change the lifestyle of the patient, their way of eating. If the patient is obese, then we can ask them to reduce weight or to do some physical exercises. And if the patient is a chain smoker, we can ask them to avoids alcohol and smoking as well. Then we have to advise them to take low sodium diet and low fat diet as well. So in case next is the slow the progress of disease, how to reduce prevent the disease from reaching to the next stage. So in order to prevent those conditions, we have to reduce the disease which has been already occurring in the patient. Like if the patient has chronic renal failure, along with that, if the patient has hypertension or diabetes mellitus, so we have to first and foremost treat that disease as well. So after that only, we slowly and progressively, so we will move on to the chronic renal failure. Next, control and treatment of hyperkalemia. So here we can mainly give medication like your injection sodium bicarbonate. If acidosis is present here, then also we can give injection calcium gluconate in advanced cardiac disease patient, and we can also advise them to take low potassium diet. Next is your nutritional therapy. In the nutritional therapy, all the food requirements for those conditioned patient, like if that patient is diabetic, then we have to advise them to take a low sugar diet. Then also if the patient is hypertensive, then we can advise them for the low sodium diet, low fatty diet, and all we can advise them. Then control of hypervolemia. In order to control the hypervolemia, fluid maintenance should be done, like how much amount of fluid needs to be given to the patient, and how for that you need to maintain a proper intake and output chart should be maintained out here. Next is correction of anemia. In case of correction of anemia, there we can do, like we can administer erythropoietin in the form of medication like epoetin alpha. Okay, then or we can advise the patient to take iron and folic acid tablets. The next is control of hypophosphatemia. Here, in order to control this, we can advise the patient to restrict here some amount of your potassium phosphate diet, like your dairy products, like your milk and all. Next, moving on to the surgical management. As I previously discussed in the beginning of this here, that if the patient is at end stage, or if the patient is at like third stage or fourth stage, then we can advise them to daily undergo for dialysis. In dialysis, mainly they will use a dialyzer. So in order to filter and purify the blood that is coming out from the kidneys, okay, by using a machine which you can see out here is the dialyzer. You use this machine to purify the patient blood. If the kidneys, they do not function, do their normal, it's not able to do their normal function. Another one is your renal transplantation. If the patient's kidney is not functioning properly, then after undergoing cross matching and all, then after that the patient, if the donor, available donor is there, then patient can undergo for transplantation. Next, moving on to the nursing management. Nursing management. As a nurse, there are certain responsibilities which we have to carry out. First, in the assessment. In the assessment, you have to assess the condition of the patient. Then we have to collect the proper history of the patient. Then we also have to check at which stage the patient is at. Next, some of the nursing diagnoses here are your fluid volume excess related to inability of the kidney to excrete fluid and excessive fluid intake, then imbalanced nutrition less than body requirement related to altered metabolic activity and dietary restriction, then activity intolerance related to fatigue, anemia, retention of waste products and dialysis procedure, risk for infection related to different immune function secondary to chronic kidney failure, vascular exercise for dialysis and malnutrition. I want all of you to formulate the nursing intervention for all those nursing diagnoses. Next, some other, this one is risk for impaired skin integrity related to edema, dry skin, pruritus, and uremic uremic froth secondary to chronic kidney failure, risk for injury related to altered metabolism of calcium secondary to chronic kidney disease, grieving and anxiety related to loss of kidney function, therapeutic plan. So these are some of the diagnoses as per the chronic renal failure. Next, prognosis. So when we see the prognosis of the patient with end-stage renal disease or end-stage renal failure patient, only 10% of the patient they are able to do their normal function, or they are able to survive. Then in India, as per the Global Burden of Disease 2015, they have seen that chronic renal failure is the 8th leading most cause of death in the world. Then prevention, how you can prevent this? By taking a healthy diet. Okay, if a patient is diabetic, then we have to take for low carbohydrate diet. Then maintaining hypertension by taking low sodium diet. Then advice to avoid alcohol, advice to avoid smoking. So all those things, they should be maintained in order to control this diet, in order to control chronic renal failure. So I hope my topic is clear to all. Anything to ask? Hello? Is my topic clear to
Yes, ma'am.
everyone, or do you have anything to ask?
No, ma'am, it's clear.
It's clear. So I will conclude my topic. So chronic renal failure, it is a condition, or we call it end-stage renal disease or end-stage renal failure. It is a condition where the kidneys, they fail to do their normal function, and the patient can only survive in this condition more months through dialysis or after the patient undergo renal transplantation. So that is all. Thank you. Thank you, ma'am. Thank you, class.
All of you understood, right?
Yes,
Yes,
ma'am.
ma'am.
Okay. CR, send me the list of student absentees, okay? Okay, then if you don't have any queries, let's end this class, okay? I'll see you in the next class. Monia,
Thank you, ma'am.
Yes, ma'am.
um, you have done a good thing, okay? You have explained everything. I hope the student understands. They understood all. Okay, then let's end this class.
Okay, thank you, ma'am. Okay, thank you, ma'am.